Welcome to our channel Medical Speech Therapy. In this video, I'm going to provide you an introduction to speech therapy and discussing what you can expect from this specialized form of therapy and how it can help both children and adults overcome communication challenges. Whether you or your loved ones are considering speech therapy or simply want to learn more about it, this video is for you. So let's get started. Speech therapy is a specialized field that focuses on assessment, diagnosis, and treatment of communication disorders and difficulties. These can include speech sound disorders, which are articulation disorders also, where speech is not clear and children may substitute or omit the sounds. And the another one is language disorders or language delays, where children may speak sounds and few words but is not able he may not able to put all the words to make phrases and sentences and and even not able to communicate, and then stuttering disorders, voice disorders, and more. So first step is the assessment. So first, when the child come to a speech language therapist, a qualified speech language therapist will conduct various tests and observations and take interviews to understand the individual strength of the child, challenges, and specific communication needs, as this will help the speech and language therapist to make an individualized treatment plan, because once the assessment is complete, the SLP will create an individualized treatment plan tailored to the person's unique needs and goals. This treatment plan is known as IEP. So after making an IEP, which is for the whole year, we break up the goals of the whole year into a monthly 12 months, 12 different months, and then monthly goals will be break up into weekly goals and weekly into the daily goals, and then daily goals also will be break up into that 1 hour or half an hour therapy, so that we in this way we plan our therapy sessions, what we are going to do in a particular session. So for example, if a child coming to me today, I have his whole IEP in front of me, and then I have take out the goals for this month, and then from that month I have divided into 4 different weeks, and then this week I have divided into 4, 5, 3, 2, or for how many sessions that child is taking. So in those days, for example, a child is coming to me in 3 days in a week, so I have divided that weekly goal into 3 days, and then those 3 days are I will break that daily goal into that 1 hour or 45 minutes sessions. So what I'm going to do in first 15 minutes or second 15 minutes or third 15 minutes, and it totally depends on each child, because some children, they love doing one particular thing in that session. And so I do in this way, that I take a lead from that child and then do the work, because if child is interested in one particular activity, then we work on that only for that day. But definitely we always focus on the goals, that we have to complete our goals. We try to complete our goals, but again we need to look the level of the child, the interest of that child, and how much he is grasping. We are not going to jump the goals, even if we have taken in our IP, but we are not going to jump those goals that we have to complete our syllabus or in that way. No, we need to look everything minutely. If my student is doing this much, then we are going to do this much, because we ultimately we want our student, our client, to learn the language, to learn the speech sounds or whatever is the requirement. So in this way we break up the goals, and similarly we are doing in our therapy sessions, then I provide those goals to the parents so that they can work at home in a natural environment. They need not to sit for everything and do tabletop activities. I always recommend my parents that please do the things in a natural way. For example, if I'm teaching bathroom things, I recommend them to revise those nouns and the uses of the bathroom objects when you are doing the morning routine, like you are in the bathroom, brushing teeth, taking a bath. All these things you have to teach in the bathroom. And while you are changing clothes, teach them all the names of all clothings, like shirt, shorts, pants, socks, shoes, whatever. You can teach in this in that environment, because that is a natural environment. All the time, if we are doing tabletop, what our child is going to learn when he or she is going to the world? So in this way, we I prefer or recommend my parents to carry over the goal at home. And so these are there are a lot of different techniques to give the intervention to children, where I provide different articulation exercises. For example, I'm using articulation stations, so I recommend them to take pictures, or to download the app, or I sometimes I provide them pictures, videos of the same thing what I'm doing in my sessions, so that they can revise articulation at home, and give them lot of different strategies so that they can do it easily at home. After that, progress tracking. Well, how do I track the progress? It's an integral part of speech therapy, and we always monitor and measure progress, make adjustments to the treatment plan as needed, and celebrate milestones and achievements along the way. So, through the IPs, work plans, we always write reviews after finishing a particular month. I always give reviews to the parents that we have achieved this much in this month and this much in another month. Sometimes we give bi-monthly reviews. If children is taking are coming only 2 times per week, then it is very less to give very less number of hours to give review immediately in 1 month. And children may take leave also due to illness or sickness, whatever. So we provide a review. That review gives information to the parents and even to the therapist. So we come to know, we can track easily the progress in through the reviews. So this is all what speech therapists do in their sessions, and how do they do speech therapy. And there are a lot of benefits of speech therapy that we provide for children, because speech therapy skills can enhance academic performance, social interactions, self-esteem, and overall quality of life. I can provide you examples of how speech therapy can help children overcome speech challenges. When children are speaking, they are interacting in the class, they are able to interact in the class, they are more confident, so they can, and if they are interacting in the class, they are learning more and carrying the learning to their home, and which is reflecting again in their classworks and in their homeworks and in their daily life, because they are more aware. If they are interacting, they are aware, they have language, they are understanding, they are listening, and they are speaking. Ultimately, their communication will be there after some time. So these are all, there are a lot of benefits of speech and language therapy. And finally, we collaborate and support. Collaboration between the speech language therapist, the individual receiving therapy, and their family and caregivers is crucial for successful outcomes. Not only with the family members, we speech therapists collaborate with the class teachers, with the occupational therapist, physical therapist, pediatricians, neurologists, and ABA therapists also. So, because this is very, very important to collaborate with all the professionals, teachers, and family members. Because if we are supporting in this way, the active involvement of each person can maximize the effectiveness of a speech therapy. All right. So this is all about what we do in speech and language therapy, and how children can show improvements after taking speech sessions if they are regularly taking sessions, and parents are working on their spontaneous language goals at home. So definitely children are improving. We have lots of examples where children have learned speaking and communicating socially. Even they are doing very well in their life. Some of them are working and doing very well. Yes. Thank you for watching, and we will see you in the next video, in which I'm going to talk about the milestones of speech and language development. So meet you later. See you later. Bye bye. And,